Hi, I'm Morse, the founder of Core Elements Training. In this video, we're going to demonstrate dry needling to the wrist flexors group. This is a really useful technique for clients that might be experiencing elbow pain. If our client had pain on the medial or the lateral side of the elbow, then we would needle on both sides of the lower arm, including the wrist flexors group and the wrist extensors group. This is a really useful technique for clients that might be experiencing conditions such as medial or lateral epicondylitis, otherwise known as golfer's or tennis elbow. Okay, our client is already in position here and we've already cleansed the skin for the wider area. So in this instance, this is the wrist flexors as the group, and we might find that if this was tight or in a hypertonic tension, or the client had lots of trigger points around this area, that she might be suffering with medial epicondylitis, which is that generalized pain, especially just above that epicondyle or just above the joint on the epicondyle of the humerus. If our client was suffering with more lateral pain, then we would still aim to take tension out of the wrist flexor group, because this group works in opposition to the wrist extensors group. But in this instance, we might find that that localized pain was more on that lateral side here, and there might be common trigger points in the wrist flexors as the group as well. Okay, so we want the client to be in a relaxed position, and as we've said, we've already sterilized the skin here. We're using our single-use sterile needles, and from here, first of all, before I come up around that elbow area, I'm going to palpate for that maximal area of tension and maximal areas of tenderness, because quite often if the tendon here where it crosses the joint is aggravated, it's often because there's a lot of tension in the muscle group itself, and that's pulling on the tendon where it attaches to the bone. So we can feel with the client here, Katie, she's got a lot of tension just there, so I'm going to focus on going perpendicular into this trigger point. So I've tapped the needle in and then we're pressing down roughly about halfway. We're always getting feedback from the client as to any sensation that they might be feeling. We're looking to see if there's any twitches when the needle goes in as well. Okay, then we can also feel a little bit more medially here that Katie's also got quite a nice amount, quite an area of tension. So when we press it down, we might find that that increases her pain sensation. So in this instance, we're going to pop another needle just there, again tapping it in, pressing down roughly halfway. And then from here, we're going to palpate just above that elbow joint, looking for that key common area of tension for this condition. Okay, sometimes, especially on first treatment, we might not go into that common trigger point with a needle because it can elicit quite an increase in pain. On second, third treatments, then we would aim to go near towards the tendon or just above the joint. So hopefully against the towel here, we can see where that needle is. Okay, once those needles are in, then from here we can leave them, especially if the client has got a good sensation. Otherwise, we can then look to activate the needles, because we're aiming to see if we can stimulate a twitch response, or we could see erythema on the skin, where that would show that we've got an increase in localized blood flow. So from here, the first activation methods that we're going to do are the flicking techniques. We want to start off with lighter activation. Then if that doesn't elicit a twitch response or any increase in sensation, we can turn the needle. Okay, just one or two turns there, and that helps to wind up the fascia around the needle, and then again can stimulate a twitch response. Otherwise, we could then pepper the needle. So in this instance, we're lifting that needle up, the tip is still inside the skin, and then we're lowering down roughly halfway. Quite often with needling to this area of the body, the client might report that they've got sensations in the fingers or coming down into the fingers. Sometimes if we see that the muscle itself isn't twitching, we might see this slight movement in those fingers. Okay, so just to summarize here then, so we're needling for medial elbow pain, and this might be linked to the conditions such as medial epicondylitis, and we have needled into the main trigger points that we've identified through palpation in the wrist flexor group as well. And we've also come just above the elbow joint too.